Hi everyone, today's video is about eczema, one of the most common childhood rashes. It's also called atopic dermatitis, meaning somewhat allergic triggered irritation of the skin. And then we like to affectionately call it the itch that rashes, which is backwards from what you would think. It is a rash that can cause itching, but sometimes in children, they'll just have an itchy spot and they begin to scratch at it, and sure enough, a patch of eczema will develop. So in infants, we typically see eczema or atopic dermatitis in the creases. So in the creases of their elbows, the antecubital fossa, or in the creases behind their knees, the popliteal fossa, or around their ankles. So it's very common, or even their wrist, to see eczema, which is a pink, dried, somewhat scaly, rough-feeling skin. It's common to see it in these creases. And if the rash goes untreated, it can even become sort of hardened. The skin feels very hard, or it's called lichenified, like almost like wooden in those areas because it's so rough. So I want to teach you quickly in this video some of the things that can trigger a rash of eczema, an eczematous rash or atopic dermatitis. In the wintertime, it's often dry air that's low in humidity, such as when you're running the heat in the house, or if they're outside and it's extremely cold but low humidity, that can also trigger an eczema rash in the winter, or overbathing, harsh soaps, perfumes, certain food triggers. If the child's sensitive or allergic to a food, it can trigger a flare-up of the eczema. Also, because we consider eczema in the autoimmune family, it often runs with seasonal allergies or with asthma. We know that if a child is fighting off a current infection, such as a cold virus or some other virus, that can actually trigger the eczema as well. And then in the summertime, we see triggers to be chlorine, also still overbathing or overuse of perfumes or harsh detergents or soaps, and even sweating. A lot of times babies will have flare-ups just from being so hot-natured or in a really warm environment and sweating, and that can trigger some of the eczema too. So I want to teach you just some very easy, practical, common sense treatments and therapies for eczema. One of them is, especially in younger infants and toddlers, if they're not truly dirty, if they haven't gone through puberty yet or have body odor and need daily showers for hygiene purposes, it's perfectly okay to bathe that baby just 2 to 3 times a week. Remember that every time they're taking a bath, especially with soap, it's drying out the natural oils in their skin, and so it can make the eczema worse. So I want to encourage you to use a gentle soap like Dove, Aveeno, or Cetaphil, or many others that have moisturizers in them. Do be careful with soaps, bubble baths, all the sorts of body cleansers that you can use in the tub or the shower that are very perfumey. Even though I love how they smell, that perfume can trigger eczema in a lot of babies. So do use a moisturizing soap. Get in the bath, get out of the bath. Not too hot of water, not too long in there. Pat dry when the baby or toddler gets out. And then on just the affected areas of the rash, you can use 1% hydrocortisone cream, which is the generic of Cordaid, and it's available over the counter. On the body, you can use it 3 times a day. On the face, very sparingly, only once a day, and never in the diaper area. We try not to use steroids for longer than about 14 days. Hydrocortisone is a steroid cream, because then it can cause thinning of the skin. And because it can cause thinning of the skin, we never want to put it on areas that are already very thin, such as the eyelids, or in little boys on the scrotum in the diaper area, and that's why we never want to use it in the diaper area in general. That's just not indicated. So after they get out of the tub, you pat dry, you put the hydrocortisone cream on the most affected areas. But then here's my best trick. I want you to absolutely saturate their body with some sort of an emollient like Aquaphor or like Vaseline. And that application of the emollient over the hydrocortisone cream will help the cream penetrate the skin better and actually do more good. Now remember, we also have prescription creams, stronger steroid creams than the over-the-counter that are available, but we have to use them very sparingly because of that concern that it could thin the skin. Also remember that the skin can become discolored, primarily through the inflammation itself of the eczema. So you can develop post-inflammatory either hypopigmentation or hyperpigmentation, meaning that patch of the skin that had the eczema flare could be lighter than the skin around it or could be darker than the skin around it. And it can really go both ways. A lot of parents ask how to prevent that, and mostly it's just doing all your standard maintenance and preventive care for the eczema itself. The gentle soaps, the infrequent bathing, the frequent application of emollients, and the sparing but routine use, if needed, of a topical steroid cream. Our goal is to use a moisturizing cream or the emollient so frequently that we rarely even have to use the steroid cream since it can have more side effects. So I once had a dermatologist tell me if parents of babies with eczema could apply cheap, easily available Vaseline very, very generously all over multiple times throughout the day, we would probably never even need to use steroid creams at all. There are now newer medicines coming out that are prescription, ones like Eucrisa, that are steroid free but still help control and treat eczema. But currently they're still available only as a brand name prescription, and they can be pricey if insurances don't cover them if they're not on the formulary for your particular insurance. So I hope this has been helpful. Please remember that eczema can look a lot of different ways. It's usually pink, rough, scaly, dry, itchy, but in some babies it can present as more circular rash that can even sometimes imitate ringworm, but it's not because there's no central clearing. It's not clear in the center of the circle. Some babies can just have a raised pink bumpy rash, and that's their eczema. So it varies a lot from baby to baby. As always, it's very careful. It's important that you consult your own pediatrician so they can look at it in person. But once you've had that diagnosis, remember that this is a very chronic rash. You can get it completely cleared, and then later it can flare up again with one of the triggers that we discussed. So it can be frustrating. Many infants who have even relatively severe eczema will still outgrow it through the years, so we remain optimistic always that this will happen, just like with a lot of childhood asthma and sometimes with allergies. So I hope this quick overview has been helpful for eczema. Always consult your own pediatrician for a rash if you're not sure what's going on. Thanks.